We are live. Come on in, folks. We're going to talk a little bit tonight about the neck and the mid-back and answer any questions that you might have, as well as get connected. So come on in. I'm going to go ahead and shout us out here. Right now, it looks like I got me, myself, and I. Oh, Brown Eye Trucker. Hi, girl. BET's in the house. Right now, it looks like I got me, myself, and I. Oh. I'm going to go ahead and shout us out here. I'm going to put us on Twitter and a bunch of other ones. So let's go ahead. I'm going to do that right now. This is Average Joe. We're going to talk about, that's right, the mid-back and the neck, as well as get connected. So get here. I'm going to put that on Instagram. All right, Instagram, shared that out, new post. Oh, I'm on Twitter now. If you see my channel art at the top, I'm now on Twitter. So, boom, throw that out. Nice, done. Tweeted. That's easy to do that on Tweet. Tweedledee. Boom, boom, boom. All right, and of course, oh boy, look at them all in the house. Coffee Madness, X-Ray ladies in the house. We always give full watch time, that's right. All right, so we're going to talk tonight. Everybody likes to talk about the neck and the mid-back. I probably could talk about each one of them solely on their own. But if you guys have any questions throughout this, you can go ahead and shout them out. I got to turn the AC on a little bit. It's kind of hot in here. There we go. I'm upstairs above the garage and it can get kind of hot up here. I also brought me some high quality H2O. Because if I do a lot of talking, I'm going to lose my vocal cords. So, let me put a post one more time on me. I didn't put a post. So let me do that quick. Share myself. Actually, I didn't share myself out to Facebook. So let me do that. I should probably do LinkedIn too. Okay, so let's see. Discussing about neck and back live on YouTube. Okay. Oh, nice. It even put my little tab up there automatically. It's kind of nice. So I did. Oh, I got to do LinkedIn. I didn't do LinkedIn yet. That's right. Shouting me out to everybody. Let's see. Discussing about neck and back live. There we go. YouTube. Post. So I tweeted myself, if you want to call it that. What's your Twitter name? Twitter name. I think it's Average Joe PT as far as I know. Let me look. Thought I had it on. That's how I put it up there, but it's hard to tell. I'm a newbie when it comes to this stuff. I learn as I go. Yeah, at Average Joe PT. So At least I got one of them correct. So let's see what we got here. All right. So, any questions about the neck or back before I get started? You know, I'll start with little mini-me since he's nice and light and close to me. You guys can look at the big one. I need a profile picture. Oh, you need a Yeah, I know I do. It keeps taunting me to do that also, and I'm so not photogenic. But I will find one. I think I put one. I'll just put the same one that I have up for my YouTube account, which is god awful. But at least they know I'm not some fakery. At least they'll get an idea who's actually there. But yeah. All right, ooh, I'm hot. It's 3 in the house. All right, we'll see what happens. I noticed there's a lot of my people that I've subscribed to. They're all doing live streams now. I know Gore's doing one every day, all day, every day. It seems like. I know the Melda family. They're doing them only 3 times a week now. They used to do them almost every day, but once he hit 10,000, he's backed off a lot. He's only doing them like Mondays, Wednesdays, and Fridays for a couple hours in the evening. So I know he's backed off a lot. All right, so let's go ahead and get started with the next since no one has any questions. All right, we're going to start with the basic anatomy. And the basic anatomy is this is also these little purple thing. All right, you have 7 vertebrae. Each one of these bones, and we're going to move Scully to the side for a second. Sorry, Scully. This little bone here, the top one or the bottom one, is called a vertebrae, and it has all these little bumps on the ends of them, and it has muscles and tendons attached and ligaments attached to them, as well as it has all types of other things like synovial. We talked about the facet joints in the past, and we talked about the bursa and how the tendon glides over the bursa to support the tendon and nourishment, as well as allowing the tendon to glide without getting irritated or inflamed or torn. So there's actual 7 vertebrae that actually make up your neck. All right, the first one is kind of an odd shape. I wish I could take this apart, but I'm scared to because I wouldn't be able to put it back together. And that one basically has a top kind of like this, almost like a circle or an O. Okay, that's your first vertebrae. And it doesn't have a spinous processes, which is these little bumps on the back side. All right, that you see on skinny people or scary alligators or dinosaurs. We've named that. And on the sides are these things called the transverse processes on the side. In between the bump out to the side and the spinous processes there is called the lamina. All right, you have one on either side of the spinous processes. And when you have spinal surgery, sometimes they might do what's called a laminectomy. Ectomy meaning to cut away or to remove. And so what they literally do is they go in there, they saw that lamina out. All right, and that, if you're looking at where, if we're having the nerve is coming out on that side, if you cut this giant piece out, it allows this nerve to really float around, and there's less chance of that nerve getting impinged again. And they really have to watch out. They only can do laminectomy so far before they end up having to fuse the actual joint together, because otherwise it would become too unstable. You'd have this joint all over the place. God only knows what would happen. But anyways, so you have, we talked about the facet joint on the side. So they go in there and they would cut that lamina out. On some people, I was thinking about this today. I was talking to one of the staff members at work, and I was thinking about, okay, sometimes they have these little holes that when you're born you don't develop completely. You might have a hole within the spinal column itself where the spinous processes just didn't develop, and there's different degrees of that, and that's called spina bifida. And there's all kinds of grades to that. Obviously, the worse You know, if you have really bad, you can have a spinal bifida, where someone who's paralyzed and has all types of neurological problems, and you can have someone on the other side of like spina bifida occulta, it's called, where they really don't have any symptoms at all. They might have some back pain, or they might, you know, the classic case is a tuft of hair down at the at the part of the spine that did not develop correctly, and so that's one deformity that we talk about, abnormalities and stuff, and anomalies of the body. Ooh, that's a tongue twister for me. And that's just one of them that, you know, of, you know, hundreds and of ones of that I probably don't even know, that I could go and look in a textbook all day long and find them. So, hi, we got Mia. Oh boy, this is a tough one. Newbie here. Yes, you are. Thank you for coming to my live stream. Hopefully we should get some more people here. Brown Eyed Trucker, BET Coffee's here. X-Ray Lady's here also, I would think. So right now, we'll see. I just started just a few minutes ago. Tonight we're talking about the neck and the mid-back. If you have any questions at all, you can go ahead and just throw them out at me. Hopefully I can answer them to your best ability. To my best ability, I should say. Thumbs up, arrow, arrow. That's right. Thank you. That's right. Don't forget the thumbs up. Definitely want a thumbs up. Thank you for making me. Oh, you're welcome. So we're talking about that particular spinal issue there. And so they'll go, and they also might do what's called a discectomy or a microdiscectomy. Essentially what they go in there is if they see like that herniation out to the side pinching on that nerve, they'll cut that thing away, cauterize it, and burn it so that it basically seals it off so it doesn't pinch against that nerve anymore, as well as cut that lamina at the same time so that nerve can free up. You know, the reality is they do the surgery and it works out. You just have to do all the stuff afterwards. You know, getting yourself out of the positions I talk about, which is the prolonged static sitting, or sitting incorrectly, or doing a lot of poor lifting techniques, and, you know, all types of stuff that I've talked about in my different back video playlists that you can kind of look through, and I will continue to make. This week's show I'm going to do is going to be about disc pain. We'll see what time on Saturday I can get that out, but I'm going to talk about different treatments and different techniques in regards to reducing your disc pain in your back. So stay tuned for that one. So of the neck muscles, of the neck vertebrae, instead of calling it neck, we call it the cervical spine, or they'll call it C-spine for short. I'm going to roll this over so it's a little bit easier for me to kind of manipulate a little bit here. And so on the side, you can see these vertebrae in the neck are much smaller, as well as the discs in the neck are much smaller, and they get larger as we go down the spine. And so that's obvious. You know, your head weighs a little bit, but you ain't got your entire torso or your body weight. And so the farther you go down, the larger your discs are, and the larger the vertebrae are to displace the weight equally through the body. Coming down from the neck, they have the same surfaces, these gliding surfaces, these what we call these facet joints on either side. And they're angled differently in the neck than they are at the mid-back and the lower back. They're angled more like at a 45-degree angle, and that actually helps us articulate or move our neck around a lot easier, just because of the natural angle of those particular joints and how they are set in our spine. Now, like I've talked about in the past, that little bump down in your neck that you can feel is the spinous processes of C7. So that's what you're feeling way down there at that area. Now, if we go back to the top, that I got distracted for a second. So that first vertebrae, like I said, is a whole. The second, or C2, is actually this thing called a dens. All right, and that's what your head kind of pivots on. You know, good old Scully here, he gets his spine, and that kind of swivels on that. 50% of your motion's occurring at that C1 cervical level, because literally your head is on a swivel. It's got a lot of ligaments around it to keep it very stable. All right, it's got all these muscles as well as the ligaments around that structure that make it strong. Now, in I was almost going to say cerebral palsy, but that's not correct. And a child or adult that has Down syndrome, we have to watch out because there's a ligament in the neck that's very fragile and very weak, and that person that has that genetic anomaly, and you have to watch out of the cervical region when it comes to someone who's got Down syndrome. Ooh, got another new one. Hello. Oh boy, this is hello everyone. Detour oh boy, this is I don't know what that is. Is that Spanish or is that what language is that? I got 6 in the house. Give me some thumbs up or thumbs down. Hopefully thumbs up. Any questions? I don't care if you think it's silly or not. I'd love to answer it. It might be a question that you ask, but someone else might have the exact same question. So if you don't ask it, multiple people might not get an answer. Hi, Nikki. So we're talking about the neck and the mid-back tonight. I should say today. If you have any questions at all, go ahead and shout them out. I'd love to hear from you. And so we just talked about the upper neck up here where a good old Scully is that C2. You have the C1 at the top. That's that first vertebrae in the neck. And then C2 is the second one, which Scully's head kind of swivels and all of our head swivels on. And we talked about Down syndrome kids or adults. You have to watch out because their ligaments in their neck are very fragile and weak. And they could prone to have a real significant problem really bad. They have to be a spinal cord patient. Oh, it's Portuguese. They're from Brazil. Hi, Brazil. Oh, this is awesome. All right, so like I said before, there's 7 vertebrae, but here's the tricky part. When we talk about the nervous system, there's actually 8 nerves. I know, it gets people messed up all the time. So there's actually C1 all the way down to C8 nerve, and that just has to do with how the vertebrae are set up in our body and how our nervous system is. There's actually 8 nerve endings in the cervical spine, but there's only 7 vertebrae. And then after C8 comes T1, which is your thoracic one, and the ribs start to come in at that point. Now, if you guys didn't know it at all, most of our lungs, the large part is really on our backside. People think the lungs are in the front, but really they're on the backside. And they're really long. They go all the way down to these lower floating rib area here and all the way up to our collarbone. And so our ribs are there, but also our lungs are very large. And so what am I saying here? The clavicle area at this first vertebrae here is way up high. That's why it's kind of tender when you get underneath your collarbone, because that first rib is actually right down there, as well as there's a lot of soft tissue, blood flow, our carotid arteries are running up there. Oh, that reminds me. I did a video back, this is probably at least 2 months ago. Hi, Sylvia's Life in Holland. Oh, she came in. She's probably going to say, let's connect. She loves saying that. Or we connect, or please connect, or someone. She loves saying that phrase. We got 8 in the house, 8 in the house. If you guys have any questions on the neck or the back, just kind of shout them out. I'll try and answer them. Hope you guys can connect. If you guys, maybe some of you guys don't know each other. I have a few people in here that are not subscribers. Or not subscribers, that's not right. They're not creators. And so they're just here. Now, maybe they might want to subscribe to your channel. I don't know. But I do know that some of them don't have any content on their website. So they're not phony or fake people. They're real people. They just come just to listen to me babble for a little bit and hopefully learn something or ask a question. All right. So we talked about those ribs come up really high underneath your collarbone, as well as your lungs are really high in this area. And so if you have any injury, like a collarbone injury or sometimes they talk about your rib getting stuck. All right, that they might have to come way up high here in your collarbone to work on that. Most of the time, if you work on soft tissue, it normally gets things to relax, and then kind of find their own fit again. Because if we talk about the ribs obviously coming all the way around and protecting all of our organs, they also stabilize our mid-back. That's the reason why you don't get a lot of back or mid-back and disc issues, because those ribs really stabilize that part of our spine. Now, it also restricts our movement, so you're kind of left with mobility or movement versus stability. You have to weigh the two. In the lower back and the neck area, we have a lot of mobility or movement, and we have less stability. And that's the reason why we have back pain or neck pain, is because there are a lot less more movement and a lot more cases of things breaking down over time, because unfortunately we get old and things wear out just like anything else on this planet. And so if we go back to where's most of our movement, and I've talked about this 100 times, but just to review quickly, if we look down or look up, 50% of our movement is occurring at this area down here, C6, C7. If we're looking at left and right, 50% of our movement is occurring up here at C1 and C2. And the reality is the other little bit in between here makes up the other 50% of looking over your shoulder and looking up and looking down. And so if you have any issue at that segment down below or the segment up above, just either one of those two segments, you're going to have a lot of restriction in your actual movements, and you should expect that, especially if someone has any type of spinal surgery where they fuse or fixate a certain vertebrae, like at C5, C6 is kind of a classic spot. Hi, Mima Gay's Lifestyle, how are you? And so being in that spot, a lot of times, you could refer pain down your arm. The reality is if you have like numbness in your thumb or in your first finger, that's actually your C6 nerve coming up in your neck. Now, you could have that nerve irritated from your elbow, your wrist, or your shoulder, but a lot of times if you're having a lot of thumb or first finger symptoms, numbness, burning, tingling, or weakness, they will probably do what's called a nerve conduction test, where they test the speed of the nerve and see where exactly it's being impinged at. And a lot of times, it's coming from the C5, C6 way up high. So that's way, way up here. So C7 is that bump there. So it's another bump or two above where you're actually having that particular problem if you're having a lot of numbness in this part of your hand. If you're having carpal tunnel syndrome issues, all right, that's the median nerve. That's the nerve that kind of runs between your bones of your wrist, are called your carpal bones. And there's a ligament over the top, and that gets thick and irritated and inflamed over time. It starts to squeeze that nerve against the bone, and next you start to have tingling in some of these fingers, basically the middle finger, the inside of the ring finger, okay? And so you'll have numbness there. If you're hitting your funny bone, which is this nerve, which isn't funny, but it's called your ulnar nerve, but it's also known as your funny bone. I don't know why it's not funny. If you tap on that, that's very superficial, so people can bump it every once in a while. Or if they sleep funny, it makes this part of their fingers numb until they can kind of straighten their arm or shake it out, and then the symptoms goes away because the nerve impingement goes away. Oh yeah, low back issues, absolutely. I got a whole playlist on low back issues, and my video on Saturday is going to be specifically about disc issues, so stay tuned for that. Hopefully I'll make it just as exciting as I did the last one. Hard to tell. Let's grow, guys. That's what she says. Connected or let's grow, guys. I knew it was something like that, Sylvia. She loves saying that. So, the ribs themselves come off of these little bones on the side here, called pedicles. People like to call that. But they also have cartilage on the sides of them that your ribs connect to. And obviously your ribs come all the way around to the front, and you have some cartilage in this area, and obviously you have your sternum here. There's a thing up here called your mambrium. You also have this thing down here that you don't want to push too hard called your xiphoid process. And if anybody knows anything about CPR, you definitely don't want to push there. You could really mess someone up. That would be cool if I actually get a whole skeleton. You'll be able to see it in, a little bit better. I'm also trying to see if I can set up at some point like a 3D live video thing, but I haven't really gotten that savvy yet with the computer yet. Maybe at some point, that's somewhere down the road, I can do that. But at this point, I'm still doing the models. But this is good enough at this point. But so we're just going to pretend little spiny here is a rib. It comes all the way around, and it kind of bends like that to kind of protect everything. And you could get this rib irritated here. Okay, you can get it. You can get the muscles in between your ribs, what we call your intercostal muscles. You could get costochondritis, which is an inflammation of the cartilage around that area. You can get it inflamed in this area too. Usually trauma could happen when if someone who has really bad maybe emphysema or a lot of coughing or anything like that, where they all repetitively moving those joints all the time, and they can get inflamed just like any other joint in the body. Oh, X-ray lady said she had a question. If you have shoulder pain, we X-ray the C-spine sometimes. Are they looking at the disc or what? So they are looking, yes. When they do the cervical spine, if that person's missing some cervical shoulder, let's see if I get this right, Joe. If the person is missing some shoulder flexion, okay, or forward flexion, or however you want to describe it, this motion that I'm doing right here, you can have limited, that could be an impinged at C5 and C6. If you have a really bad impingement at C5 and C6 or C6 and C7, it can affect your shoulder flexion or your ability to lift your arm at all. And so they want to delineate the difference between a rotator cuff problem and actually a cervical spine problem. So that's one thing that might be doing why they're looking at the cervical spine when they're also looking mainly at a shoulder problem at the same time.
I'm having trouble hearing.
Yeah, Siri's getting mad with me. Let's grow. I had a question. Did you see it? So the C-spine sometimes, are they looking at the disc or so the cervical spine, that they, as the X-ray lady, that there's no soft tissue at all. All they can really tell on an X-ray is if they're looking at the height of the vertebrae. So if the vertebrae is really flat down at C5 and C6, then you're going to have to say, all right, now you can justify an MRI, or at least you might justify movement X-rays of flexion extension and see if you're having any translation forwards on one vertebrae versus the other, in millimeters. How much translation, if you look flexion or extension, if they're having any type of movement, any spondylolisthesis forwards, then they're obviously saying, okay, yeah, it's a neck problem. We better, forget the shoulder right now. Let's make sure that neck's fine. A lot of times the cervical spine takes over everything. Let's say this sweet person down here is talking about, I have chronic low back pain, but they have a lot of weakness in their legs, and they're also they do a whole spine X-ray, and they notice that their neck is also like really bad. They're like, uh-oh, maybe a lot of this is coming from the neck, and so they'll go ahead and try and rule out the neck issue, making sure that it's not affecting their legs at all, like a spinal cord impingement issue going on at the neck. And so that's one thing that they'll make sure. So the neck trumps everything else. They got to rule all that out first before we look at the shoulder and before we look at if you're talking about this other person's back or leg symptoms. That's right. Ooh! They spelled it correctly too. Costochondritis. Nice. All the way from Brazil. All right, going through that right now. So you're going through costochondritis or the lumbar pain? I thought it was the lumbar pain. Mama Gia Lifestyle, hello, I missed you. I'm so sorry. I hope you're still here. I missed you. My bad. I was flapping my gums. No, I didn't want to lose it. No. Whew. I thought I deleted you for a second. All right, if you haven't, put a thumbs up. I'd love it. If you have any more questions, throw them out. Otherwise, I'm going to keep on going. So, like I talked about, there's actually 8 nerves in the neck, even though we have 7 vertebrae. So that's a nice little quinky dink that the body is designed. I guess you could say. No, I'm not going to say design. You know people, how they want to jump on that boat. Or evolved. I'll say evolved. Sounds a little bit more scientific. Oh, I bet someone's step on some toes for saying that. Anyways, there's this little thing, this little hole down the neck part up here, and that's where your vertebral artery is at. And that's a very important artery because that goes all the way to your brain. And you know, besides the carotid artery, the vertebral artery goes up into the brain area and obviously nurses, you know, all that stuff up in there. And so it's very protective area, you know. You got these chiropractors and you got these people doing these manipulations on this neck, and I'm like, more times than not, you don't have to do a grade 5 manipulation on the neck. They'll talk, oh, I got to get in alignment. You really don't. If you can get the soft tissue to calm down, whether it's through E-stem ultrasound or the manual techniques or the Theracane techniques or the E-stem techniques that I've shown you that you can do at home on my playlist, hint, 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 of the neck, you can go look at that. A lot of times, once you get those muscles to relax, the rest of it will also, your joint will also start to relax too, because it's a feeding cycle. You know, the joint gets inflamed, and then the muscles start getting inflamed, and then the muscles keep the joint irritated and stuck and stiff. And so if you get those muscles to relax first, then the joint starts to calm down too, and your motion starts to return versus trying to do a manipulation, and all you've done is kept those muscles in spasm or tight even further. So a lot of times I am not an advocate of doing a manipulation. Now, if you were to talk about just doing some mobilizations, not a grade 5 manipulation, you know, on the joint. I've done a lot of those because sometimes the joint just gets stiff, and then you do that in combination with some other treatment techniques. And I showed that. I showed that in a playlist a while ago. It's a whole guy called Mulligan. He did what's called Mulligan's mobilizations. And you can do these things called self-mobilizations. And what he did is he took the end of a towel, just make sure it's a nice sturdy towel, and all he did is kind of put it behind your back, and you make sure this side's very rigid, very taut, and you go ahead, and you have to look at a 45-degree angle. And why? It's because of what I said to you, is that your vertebrae in that area are gliding. So this facet joint is angled at a 45-degree angle, and that's how we want you to look when you're doing this mobilization. So you want to look at a, you know, kind of that, what we call an oblique or 45-degree angle, and you want to just gently kind of come up and then relax. And then slide down again, looking at 45, then coming up in that angle and relax. So I'm kind of going towards where my ears are, that same kind of angle. And that's a nice little mobilization you can do, as long as obviously you're not dealing with a spinal cord or a fracture or cancer or anything else, making sure that this is a mechanical problem. But some of the therapists will do that if you have neck problems and it seems like you've probably just tweaked something in that neck. They'll do what are called self-mobilizations or Mulligan's mobilizations, and that's how they do it with that technique. And so if we look at it, yes, lower back, but I was also told I have costochondritis. It gets more and more confusing. Yes, it can, but usually with the lumbar spine or the lower back, we're not talking about costochondritis. That's the mid-back area in the ribs, where the ribs connect, the costeo cartilage and stuff like that. So I don't know why they were saying your lower spine, because your lower spine, the lumbar spine area, doesn't have any ribs. So I don't quite. Maybe you could have both in two different problems, but definitely the lumbar spine doesn't have any relationship to costochondritis up here. Now, if you want to talk about some, connect the dots, connect the dots somehow and say, oh yeah, your posture and the way you were sleeping caused your lower back. I mean, that turns into some sort of Mission Impossible idea at that point. I think you might be barking up the wrong tree, but you could have two separate problems. They both. Oh, so you have two different problems. Oh, okay. Yeah, that makes sense. I mean, you can. Blah. Oh, what was I talking about? Oh, I lost my train of thought. What was I thinking for a second? Help me out, people. What was I just saying? Let me get a drink here. Let me reflect on what I was just talking about. All right. Maybe it'll come back to me, though I hope so. I was talking about Mulligan's Mobes. Oh my God. This is what happens when I haven't ate since 12 o'clock and it's 6 o'clock. I haven't eaten in 6 hours. So somewhere in this broadcast, I'm going to have a snack because otherwise I'll probably pass out on you. But yeah, Mulligan's Mobilizations, and they have a whole book on that. And so that's a simple technique that you could easily do at home if you're having neck problems. Magic towel. You can use it for a lot of things. Okay, and so, like I said before, the vertebrae get larger as we come down the spine, as well as the discs. And so when you have a disc problem up in your neck, it's a lot more serious because all the things are more fragile up here. You have your spinal cord versus on Sunday where we talked about where your spinal cord ends about, oops, I don't want to hurt my spine here, my guy or girl. Your spinal cord ends about L1. And so from there, it's kind of like what we call the horse's tail. So we're not dealing with a spinal cord injury. We're dealing with peripheral nerves, the nerves off of the spinal cord. These little things off to the sides, which are bad, but not as bad as a spinal cord issue. Up in the neck, with the neck being so small and the disc being so small, that the nerves can get pinched much quicker because the disc is just not as big. It's not designed to take all that stress. So when you hear people like, people who put up like sheetrock and stuff like that, and they're holding the sheetrock with their head while they drill the sheetrock, the whatever they're drilling screw into the wall, and they're supporting that giant sheetrock on their head, and I'm thinking, oh my God, this neck was never designed for that. And I remember I've seen plenty of those, carpentry and stuff like that workers, or people who just do sheetrock, or people who just do spackle all day long, and they have a lot of neck problems just because they use their neck as a shelf instead of using their arms, and so they end up having a lot of neck problems. But you can see it's not a lot of space, and if a disc gets irritated or gets flattened out or thinned out or worn down, you can have a lot of symptoms in your hand. Your entire hand, part of your hand, just like in your legs, in your lower back area, those peripheral nerves get inflamed or get pinched and have this whole, what we call histamine response, where the nerves get inflamed. You can have weird spotty symptoms, and you can have numbness just in this side of the hand or arm, or in these two fingers that I talked about. So this is C6 nerve, C7, C8. See, that's that weird C8 nerve where we don't have a C8 vertebrae or C8 bone, but we have a C7 because the C8 nerve is below C7. Okay, so C7 nerve is above, between C6 and C7. If you're wondering where the heck that C8 nerve is, it's below. It's between C8. It's between C7 and T1. And so T1 is up in this area. If you have some weird numbness in this area, Next thing you know, they're looking at your mid-thoracic area. You sure you're drinking just water? I'm sure I'm drinking just water. I have to go to work tomorrow, which I'm very thankful for that I still have a job. There's what, I don't know, 6, 9 million people, whatever it is, out of a job. It's pretty crazy. What I see this afternoon is like 175,000 deaths from this stupid virus already in the world. It's pretty nuts. Hi, host, the Filipino wife in the USA. How you doing? Now, I should have more than 7 people in here. Now, there's no way I just have 7 people in here. No, that's all I have. People have left. Okay. Yeah, people have left. People have come and gone. Okay. I thought I had more than 7. At this point, I probably have had at least probably 10 or 11 come and go, or at least come and some go. So anyways, what I was describing there to you is if you have some sort of nerve impingement going on in your neck, it's going to affect your sensation or the feeling in your hand or your arm or your shoulder area. And so that's what we call our dermatomes. And our dermatomes relate to whatever nerve we're talking to. And so we have an idea if you're having numbness in a certain part of your hand or wrist or elbow or something like that, if you lost your sensation or burning or numbness, we know because it correlates directly with the nerve or whatever nerve that we're talking about in your neck. And so that's your dermatome. Your myotomes is your muscles. And so our muscles have, our muscles in our body are also connected to obviously our nerves, and so we know which muscles, if you're weak in your biceps, that's your C5, C6, and then we have your elbows, you're extending, that's C7, and so we have our thumbs and our fingers also have C8 and T1, and so shrugging and all this, the shoulder blade pinching, we know whereabouts your actual problems coming from in your neck just by doing a quick examination of your range of motion and strength as well as your sensation issues. We have a pretty decent idea what's going on right just from that, and then you can do imaging to figure out directly an MRI, a CT scan, or you can have that, like I said earlier, a nerve conduction velocity test where they test a specific nerve and seeing where it's being pinched at or where it's slowed down at, as we start to look at what's going on, or your grip strength or whatever, or your pinch strength, whatever is you're missing at that point. So it's a really interesting part of our body. When you look at the bones themselves, they're really oddly shaped, and they're that way for obviously movement. They're not there. They're there a little bit for stability, but for mainly the way everything's designed in our neck is for mobility or movement, obviously, because as I say, evolved, we want to have as much movement as possible, because whether it's for hunting or whether it's for some kind of predator going to try and eat us or kill us, whoever didn't have a good neck motion didn't live very long. And so the reality is over time, at least the way I look at it here when we talk about the structure of the design of the body and its magnificence, is how it's designed. Now, I don't say that for this stupid lower part, this L5S1, that gives me grief all the time and gives a lot of other people grief all the time, is this last vertebrae in your back, and it's more of a wedge shape. It's more like this. It's like a wedge, like a pizza wedge. Or a piece of pie, or cookie or whatever. No, I guess you could have a cookie pie. I was thinking of pumpkin pie, but anyways, and it puts a lot of excessive stress on that disc. Now, even the dumber part here is 50% of our movement bending forwards and backwards, 50% of that entire movement comes from that spot. And so, yeah, when you have a back problem, first thing they're going to look at is L5S1, because one, it's not the best design because it gives a lot of mobility, but the stability is lacking, and that's why they harp so much on the abdominals and the lower spinal muscles to try and get them strong enough to really stabilize that spine as much as possible. Most people that have back problems have too much mobility, have hypermobility, which wears the disc down more, wears these facet joints down more, and next thing you know, you have facet syndrome, like what a lot of us are dealing with. You know, they say it's a degenerative disc, but a lot of times that's not what's causing the symptoms. It's a secondary problem. What's causing your symptoms is probably the facet joint or the inflammation occurring onto the nerve that's causing most of the symptoms, not actually the disc itself. Filipino's wife says, "You're doing great, host. I'm doing so great, I'm down to 5 people." X-Ray Lady says, "I'm still here. I haven't left you yet, Joe." Well, that's very nice. I appreciate that. So, we've talked about the neck a little bit, the nerves, the sensation, and that whole bit, and the weaknesses. We talked about where most of the movement occurs for rotation, and where bending, looking down, looking up occurs, which is down lower. We kind of described to you all the little bones, and we said all the discs are pretty small up here, and how they can get, you have a lot of disc problems, unfortunately. And you start to deal with what we call fusions. And so in the neck, they really don't do laminectomies and discectomies and stuff like that in the neck like they'll do in the lower spine, because the lower spine has a bigger bone, it has a larger disc, and so you have more of a chance to have a strong, stable joint even if you take some of the joint away or the bone away to relieve the nerve. You still have enough left there that the surgeon's not worried about another issue going on post-surgery. Now the reality is this: if you have back surgery, the statistic is you probably will have to have another back surgery within 5 years. Now I haven't looked at the studies in a few years, but that's kind of was the going rate, and it probably still is today. They've reduced, at least to what I've seen in my experience, they've reduced a lot of just surgery because you have a disc bulge or something like that, because their outcomes were so poor, you end up having to have multiple surgeries. The reality is a lot of times the disc comes out and bulges and comes back in and scars down, and you're left with some inflammation, and that has to calm down, and that can take weeks and weeks and weeks if you get the darn thing inflamed bad enough. Oh, Brown Eye Trucker says, "I'm here. I'm still here. I haven't had to go eat dinner yet." Me neither. So, that being said, I never really thought that L5S1 was a really smart thing. The reality is, if the premise was, and I don't know how true this is, and that's up for a huge debate, and I think it is myself. If you look at, if we were on our hands and knees at one point and we came up, it would classically make sense. That's how it was designed for. Now I could see the kinematics and the how the movement of the spine is and how it was designed. I could see how that would make some sense. I don't know how. I'm not sure. I'm not a guru when it comes to gross anatomy. I'm sure there's someone out there obviously a lot more qualified than I am, but that's what I learned in school. That's why the design is the way it is. But unfortunately, it does over time wear down. I would love to see more stem cell research being placed on improving the disc itself again, rehydrating it, quote unquote. Getting the facet joint symptoms to calm down versus just giving them steroids to calm them down. Truly, if we could get some way to, pull back the hands of time and getting the disc rehydrated, getting the facet joint not so thick anymore, and the ligaments along the backside of your spine that thicken up over time from trauma, to get them to kind of regenerate. There's only a real few treatment techniques out there that basically is cutting edge for that kind of stuff. It costs you $20,000 a shot to have something like that, and I'm not even sure what the guarantee is on that. They also do, some plasma stuff, injection into the disc area. They've talked about that to help because there's not any blood flow really. It's only on the outside vascularization to the disc area, and that can be traumatized too. So they talk about taking, and taking plasma in the area and kind of injecting that into the area to see if that will help kind of promote healing and growth to the actual injured site. But needless to say, some of the times that's just a shot in the dark. Hello, everyone. Hi, Jacqueline. Go ahead and get connected if you like. There's 9 in the house right now. Hopefully, we'll get some more. Some people here are not creators, so they might subscribe to you. I don't know, but realize that they probably don't have any content on their site. And that doesn't mean they're fake. There are real people. They're not dummy accounts or whatever, however you want to call them. So they're here consistently every time that I do a live stream, which means they're angels. Oh, I got Jacqueline connecting with BET. That's right. I learned that last time. Brown Eye Trucker, BET. You know what you could do there? Is almost like that would be, I don't know if you could or not. I don't think you want to, maybe you want to change, not change your name, but add your name. You could always put in parentheses BET next to Brown Eye Trucker. I don't know, that's something that'd be cool. I don't know if you want to do that or not. That's just a thought. Absolute McGregor's in the house. No, there's no dummy accounts here, McGregor. I promise you. The people that are here every week. They're here for all my lives, and I know they're not dummy accounts. All right, so I'm talking about the neck and the mid-back. If you guys have any questions, throw them out. No question to me is a dumb question, only one that you never asked and you don't have an answer. I'm talking about the neck and the mid-back. Talking about all kind, what these little bones are in our spine, in our neck area, and in our mid-back. You can see as we go down towards the hips, or the pelvis we call it, our bones get larger, our discs get larger. The spaces in the vertebrae, these things, these little holes here on the sides where our nerves come out through our spinal cord, they get larger, okay? And unfortunately, when we start to get the degenerative disc, that starts to flatten down. That's another side effect of as we get older. Our natural occurrence, our degenerative disc, which is a normal occurrence in the human body. Hopefully, if I ever do anything on YouTube, I'll educate enough people to realize that DDD is not a death sentence. It's a normal occurrence of the body. It's what happens secondary to that is really the inflammation of the facet joint because it takes on more stress. Because the vertebrae, the two bones aren't as high as they used to be. As the disc starts to flatten out, the bones come together, which starts to, as you can literally see, starts to affect the joint on the back side of your spine. These joints here that make up our spine start to get inflamed, and then they often get the nerve off the side inflamed and give you symptoms. I like the idea, or you can say BET like you BET at the casino. Lots of laughs. Ah ha 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 ha. How do you keep from having that big hump at the base of the neck? Oh yes. X-Ray Lay's talking about Dowager's hump. So that's the Dowager's hump. And some of that, unfortunately, comes from posture over time. All these people at the computer, or I call it tech necks. I'm not sure if that's a technical term. We'll call it that. Where you're kind of tech necking all the time, whether you're on a tablet or if you're on your phone. So if you have this going on, so you have this kind of like this forward head, and you kind of have this bent looking down. Ooh, that kind of tweaked me a little bit. I'm getting old to be doing that nonsense. But you can start to get this hump over time. And yes, there are two kinds. There's now we're not talking about kyphosis. That's in the mid part of the back, or kyphotic back. All right. We're not talking about scoliosis, which is kind of a rotation and twisting of the back, and there's a couple different kinds of those. We're just talking about here at the base of that C7 bump that we have here, way up here in this neck, you can actually start to get a hump in it, and then that means you're really just pivoting or moving from up here, your upper neck area, and you have this big lump down in here because this part of your neck is starting to get arthritic. Because you're moving way up high all the time. You're moving from this point up here and never moving down here. And so you never get that entire neck to kind of open up. And next thing you know, you have that hump. And so you have to be mindful that you catch this early enough because, yeah, you could realistically, no science fiction here, your spine can naturally fuse in spots if you don't move that way. And we're talking years. You know, the arthritis sits in, the joint stops moving, and it starts to kind of basically fuse together like like the surgery they fuse with rods and plates. But, you could actually have a natural fusion anywhere in your spine as well as in your neck or your lower back. I have adult muscular dystrophy, Would getting adjustment help or is dangerous? Years ago, I did. It felt so good, but years later, I'm in a wheelchair. Oh, Janet. Well, I want to say thank you. If you haven't subscribed to my channel, please subscribe to my channel. I bring all kinds of content. I try and make it somewhat funny. Most of my newer stuff, everybody else can attest to this. Probably the last 10, 12 videos got my has my moderator in there with me, Mr. Scully, and I also brought in Mr. Cool Cats and Mr. Know-It-All. But so she has muscular dystrophy, and that's a very span MD is. There's all kinds of people who have muscular dystrophy. What muscles does it affect? She's in a wheelchair. She's talking about having an adjustment done. Now, there's different degrees to having a spinal adjustment. You can have people, chiropractors, all right, and I want to beat on them, but sometimes I do. They have this little injector thing. It's got a spring and a little rubber end on the end of it, and it almost looks like a corkscrew, like you would unscrew a cork. It kind of looks like that a little bit, the handheld part, and they'll kind of push, and it has a spring. It'll pop and pop, and they talk about doing a mobilization. I mean, that's no different than me just gently pushing on your neck. And they're going to charge us. They're going to charge you a mobilization, and it's the same charge for manipulation for that. A mobilization and a manipulation are two different things. A lot of times people will make them as one word. They'll kind of intermingle them, and they're really not. There's different grades to a mobilization. So there's a grade 1, which is the most light. You really don't get anything moving. There's a grade 2 where you might have a little bit of soft tissue movement. There's a grade 3 where you're starting to get a lot of the joint to move. There's a grade 4 where you're at the end range of the joint. And then there's that grade 5 where you're at the end range and then you're doing a thrust at the end, that's the manipulation occurring. I guess, if you want to call the whole thing manipulating, yeah, you're manipulating soft tissue. But when most people think about a spinal manipulation, they're really talking about the high velocity thrust at the end range. And so that's what people think of when you talk about manipulation. But there are 5 grades to a spinal or a soft tissue manipulation or mobilization. So you just have to watch out. With muscular dystrophy, yes, I mean, depending on, obviously you would see a specialist. I would probably, obviously I go to a physical therapist. We would look at, is the joint really need to be manipulated? Is the joint, because it's stiff and rigid, is it actually giving you stability so that you have some sort of movement, whether we're talking about the trunk and sitting, if you're that kind of person who has that kind of muscular dystrophy, or if we're talking about transfers, you have to be mindful that if you start having manipulations done. So this lady has a severe curvature of the spine. Okay, FSHD, right. I'll get back at you, brown-eyed trucker. So that's Jacqueline. Johnny Price in the house. Thank you, Johnny Price, for coming. I got 10 in the house. And so she's talking about severe curvature of the spine. So she's probably got, she's talking probably about a double S curve or a compensatory. You have your curve, and then you have a compensatory curve, which is, I don't want to get too much lingo, but you have your active curve, and then you have your other curve, so your head comes upright. Otherwise, you would be stuck like this all the time. So you have that, what we call your compensatory curve. And so, but there's a lot of rotation that occurs as well with that rotation to the side or side bend, and there's a lot of rotational components to this particular issue. Let's see if I can get this facet joint to come out for a second. I can't. So you'll get a lot of rotation movement, and so that can cause a lot of stress in that facet joint, cause a lot of pressure and a lot of pain, and that can get inflamed, as well as the discs themselves can get flattened and thinned and worn down because there's so much stress occurring at that spine, as well as you can get a lot of costochondritis in that area because the ribs have to rotate too, depending on how much angle curvature that we're talking about. So I would say go see a physical therapist. There's definitely no home treatment for this because we'd want to make sure whether if we do the manipulation or whatever you're having pain at, we better make sure that that's not giving you enough stability during a transfer or during sitting positions or something along those lines. So you have to, as a physical therapist, we have to weigh cost-benefit ratio. And is there anything else that we can do to kind of reduce your pain and manage that? If you're in a wheelchair and you're doing a lot of static, prolonged sitting, we have to, obviously you have to worry about pressure relief techniques and stuff like that I'm sure you know all about. But also you have to be mindful that you're not becoming a C, that you're getting a lot of stress at the L. Basically, the entire lumbar spine is now a letter C and it's causing a lot of stress. You might want to take good old towel roll if you can, all right, and put it down at your tailbone so you're getting more of this going on, so you're staying out of that C curvature type of movement, so that you're kind of keeping yourself a nice little, as best as you can, because you have, like you're talking about, you have a curvature of the spine. You want to make sure that you're at least unloading, obviously, the pressure points, as well as giving your lower back a break so you're not doing a lot of prolonged static sitting, because that's going to stress everything just as bad as anything else, lifting, tugging, twisting, pushing, or pulling. I'm hoping that helped you out a little bit. Okay, on to the next. Any more questions? No. Okay. On to the next thing. So we talked about that little vertebrae down there. And I was just trying to relate that movement of the L5S1 and how much movement occurs there to this area up in the neck. The C1, C2 for rotation, and that C5, C6 area for flexion, or looking down and extending, or looking at extension, or looking up, however you want to describe it. So, and you have this delicate area here. You have those nerves. You have the vertebral artery. You have your carotid arteries on the side. Obviously, you have your esophagus and your trachea and all that in this area that you don't have in your lower spine. And so you have to be a lot more gentle at the neck area than you do at the lower spine. Obviously, you have other things down here, but you have to be very careful up in this neck area. It's very easy to get things inflamed because everything is so darn close together up here. And you got a little bit more breathing room with treatment and stuff like that in your lower back and even in your mid back. In your mid back, you got a lot of room because the fact is you have your ribs that are stabilizing this whole vertebrae here, as well as the disc and everything else. You know, a lot of people, if they talk about they're having mid-back pain, most times than not, it's usually either postural dysfunction, where they're very kyphotic around it all the time, or they're getting referred pain coming from the neck going down into the mid-back, or from the lower back going up into the mid-back, because the reality is you have a lot of muscles that generalize what we call the erector spinae, and that's just a group of muscles that go along the entire spine. We can go all the way down to the muscles that are literally connected in the little lamina area called the rotatory muscles that initiate the rotation of the spine itself. And we call, you know, we have 3 different layers. We call them the deep, and the deep muscle groups of the spine. And so they are layered, you know, all over the place because of how they move or how they make a certain joint move. You know, essentially, if you're angled this way, your movement's going to be in this direction. You know, kind of like the hip. You know, we have this one muscle called the quadratus lumborum muscle, attaches to your lower ribs and your vertebrae as well as the top of the hip. And so that can get irritated. And so just the weird angle of that. And it's no different in the mid-back or the upper back. Let's get this old shoulder blade off of here for a second. We'll kind of put it on here. And you can see here, as you get around this area, you got a lot of the muscles that attach from the end part, or what we call the medial border of the scapula, or the inside part of your shoulder blade, and they attach over to the vertebrae because those muscles pull the shoulder blade in and allow it to relax and come back out, with the muscles in the front pulling it forwards. So yes, you know, if you have some mid-back pain, some of the times it's just coming from the shoulder blade. You know, maybe you're too rounded, maybe you're doing a lot of forward movement all the time as well as looking down. That can irritate all the muscles along this shoulder blade area. You think it's coming from your mid-back, and it's really just coming from the shoulder blade itself. Excuse me. Oh, okay, so Yannette says here, Miss Cortez says here, yes, the ribs poke out and it hurts. Okay, thank you so much for your time. Info, yes, my right butt cheek hurts. Yes, spine is a letter C. Seems when I keep my legs up, it relieves the pressure. Yes. Yeah, well, the problem is you're doing a lot of prolonged static sitting. You're probably, like you said, you're having a lot of C sitting. And so if you're able to lift your legs up, you're kind of gapping the spine even more if you look at the space here. But the reality also is you actually cause some more inflammation because you are stretching out the facet joints where my finger is on either side of the spine, and it's kind of like a cascade effect because you're doing a static stretch when your legs over the top. It relieves them, but once you get out of that position, you cause a lot more inflammation in that lower part of your back. So it's kind of like a catch-22. It feels better, but the reality is you're causing a static stretch over a long period of time, which also causes a lot more inflammation. So if you can, if you did maybe lie on your side more, okay, you can get the area to calm down inflammation-wise. Maybe if you want to ice it for a little bit, if you have normal sensation in that lower back where you can tell ice or heat, I'd rather have you ice this lower back for 15-20 minutes, be protective of your skin, and do that, 20 minutes on, 30 minutes off, and do that several days. Stay away from sitting so much and see if your symptoms calm down. And when you do sit, you sit in an upright position. You don't sit like the letter C. You'd be surprised a lot of your pain will probably calm down. So, that might help you a little bit, Miss Cortez. Got 9 in the house right now. Give me a thumbs up. If you give me a thumbs down, that's okay too. I'd smile if you just gave me a thumbs up. Shout me out if you could. I love that. If you have Facebook, or if you have, somebody on your YouTube account, or LinkedIn. I've on LinkedIn. I shouted myself out there. I'm new to Twitter. I tweeted myself out there too. And so I'd love to have other people come in. That would be wonderful. I always endorse more people, obviously. And if you haven't subscribed, I'd love to have you subscribe to me and to Scully. Okay, so the next thing we're going to do is we're going to look at some of those muscles in that neck area. So let's go get Big Bertha down here, Big Mama, or Big Dada, however you want to look at it. And so when we look at these muscles, we have some really tiny muscles along the base of the skull that attach to about this first and second vertebrae in here, the second one. And they're called your nodding muscles. Those are also called our suboccipital muscles, and those darn things can give you a headache. Ain't that right, Scully? Oh, he's not talking right now. But let's go ahead. We're going to take Scully. Let's see. Can Scully fit on this a little bit? He kind of can a little bit. Look at that. Scully, look at that. Scully's got two bases of skulls now. But if you look, if this base of the skull was here, so it connects there, and so it allows your head to nod up and down. What we call these are called our nodding muscles. All right. And in a whiplash injury, they get inflamed and give you what we call suboccipital headaches. Or if you're looking down for long periods of time on your phone or something like that, you can get headaches across the front or over the top of the head, and it'll just give you some screaming headaches. A lot of times people will just take ibuprofen, but be mindful where they're coming from. They're coming from a looking down motion for prolonged periods of time. It can give you, lightheadedness. If there's bad enough, it could give you vertigo symptoms, like the room is spinning, or you just feel kind of off. Your room ain't spinning, but you just kind of feel not really lightheaded or dizzy, but kind of, I guess, off would be the best description. And that's coming from those suboccipital muscles. And boy, they're tiny little things, and they are a bugger. Once they get inflamed, you're better off icing them. That'll at least take a lot of those symptoms away. I think I did a video on that in the neck playlist I did a while back on suboccipital headaches. And you can look at that. It's an older video. It's got good content. But like I said, it's an older video, so it wasn't made as well as one of my newer videos is. Seems when I subbed to you a couple weeks ago, and you did the same. Thank you, love the info you give. I wish I knew I was like this and just stopped being able to walk one day. Yeah, I'm sorry, sweetie. That goes to show you, what we take for granted. I take for granted all the time, and I treat people. I don't treat a lot of muscular. I haven't treated muscular dystrophy. I did a lot of neuro years ago, spinal cord stuff like that I used to see. But yeah, you don't realize what you got to it till it's gone. You just don't. The simple things of bowel and bladder movement. When you can't control your bowel or bladder, you're pooping or peeing for the lame person. Or being able to sustain, pain is one thing, but when you can't get up no more to get away from the pain, you just don't realize it, And even though I treat people and realize it myself, or when I go to the nursing homes and realize, what happens or what can happen when you get older and when you abuse your body, I just take things for granted even today, even though I treat people with those things. I guess it's ignorance or just ignoring it or just a coping mechanism. I guess if you're a psychiatrist. One of my old classmates in high school, she's I don't know if she's a psychiatrist or psychologist. I never asked her, but I don't think she probably doesn't even know I'm a YouTuber. Her name is Teresa. But anyways, that's probably more their route. My abdominal muscles are gone. Yeah, if you have depending on your muscular dystrophy, whatever it's hit neurologically wise, yeah. I mean, if it's shot your abdominals, then you're probably a lot of that stiffness or rigidness with your movement, the stability you're getting is from your spine and from probably the kyphosis or the scoliosis, whatever is going on with you. So you're getting some of that joint mobility, that joint stability, I should say, holding your trunk up and getting you to transfer differently. So you'd have to watch out doing a lot of mobilizations on your joint because you might cause, what I call Pandora's box. You open up Pandora's box and you can't close it. So it might affect your ability for stability or for mobility, or it might cause more pain. So yeah, I would probably talk to, obviously, your neuro doc. I know you have a neurologist.
if you have muscular dystrophy. So I would talk to them about that. They might get you into pain management and see what you can do with that. Because it does hurt after a while. Yeah, I can only lay on my right side. Thank you again. Yes, sitting hurts more. Yeah. I've seen many doctors. No one has explained to me the way you did. Oh well, well you're very welcome, sweetie. That's a very nice compliment, and I always feel good when I do stuff like that. You know, that was one of the things I wanted to do for people coming onto YouTube. Obviously, you know, everybody wants to make it in YouTube. You know, it's a lot of work if you've never been a creator. You know, it's even just what I do. You know, the little 9 or 10 minute video that I do takes me about 3 days to make, over 3 days to make that. And so, and I'm not very good at it yet. Obviously, I'm getting better as time goes on. But yeah, it's a lot of work. So it's nice, you know. I take solace knowing that I am helping people, even though I'm not no big YouTuber, but by no stretch of imagination, I think I have 1,300 subscribers. I'm not. People would say you're not really a YouTuber until you're monetized. So I'm not making a dime off of this either. But I am making it. Sometimes just feeling better is a lot more than money. So thank you. All right, I got 7 in the house right now. I got a few people dropped off. That's all right. That's okay. So let me go ahead. Give me a few minutes. I want to go ahead and see if I can get a snack quick. I'll be right back. All right, folks, I'm back. Is anybody still left? Oh, I got 10 in the house. I gotta go. Have a great night. Thanks for answering my questions. You're welcome, X-Ray Lady. I got a rod put in my spine. Would I be able to walk? I'm 44, but stay positive. It would really depend. It would really depend on a lot of things. I mean, not knowing your history or anything. It would depend on if you have what we call contractures, where the tissue itself, let's just take a simple example, is your ankle. And let's say your Achilles tendon, that tendon that goes down. All right, if your ankle can't go up and down because that tendon is contracted because your ankle doesn't naturally move anymore, for that tendon to lengthen and shorten, that might be a debilitating thing. So any type of contracture could be in any tendon or hip, or your ankles, or your knees, or your shoulders, or anywhere like that. So contractures are one issue for you to be able to walk if that's a problem. Obviously, which muscles are not functioning like they're supposed to, what type of equipment you might need, whether it's a walker or crutches or devices like that. You said you're in a wheelchair, so don't know how long you've been non-ambulatory, but there's a lot that goes into seeing if walking is actually plausible. I had to eat something quick. I was getting really hungry. I got 9 in the house. So, try not to eat with my mouth full or talk with my mouth full. When we talk about the muscles of the neck, they can get really irritated very fast. You have the scalene muscles. We're just going to talk about the big ones. Scalene muscles, you have them right down the side here. You have the big one on the back side. We'll show Scully here. This little thing behind your ear is called the mastoid bone. And there's a big muscle group called the sternocleidomastoid. That's a muscle that runs all the way from the back of that ear where that bump is and kind of splits, or what we call bifurcates, a bifurcating muscle. That one muscle splits into two and attaches to the sternum and the clavicle. All right? And so those are big on each side, the scalenes. You have these big muscles in the back called your upper trapezius muscles. And there's 3 different groups of those, but we're just talking about the neck area. We talked about the suboccipital muscles that run the base of the skull, like on Scully here on the bottom part. That's your nodding muscle. Oh, thank you, Miss Cortez. You have the muscles along the spinal column. They separate out into a couple different ones that run from the spine to the neck. We have called the splenius capitis, the splenius cervicus. There's a bunch of little muscles there. They allow us to flex and the muscles in the front, well, excuse me, the muscles in the back allow us to extend, and the muscles in the front allow us to flex forwards, as well as we have them on the side that allow us to rotate. And some of them help stabilize the joint movement as while the other muscle groups are actually doing the action. And so when you have neurological problems like muscular dystrophy, if some of those muscles aren't stabilizing, working to stabilize the joint, in this case the neck, while the other muscles are causing the action to occur, you can get a lot of problems there. And so we have different terms for that. But the reality is a lot of these small muscles, they all have to be in harmony with one another, working with one another, while other things cause the joint to move. And so when that doesn't happen, you get a lot of wobbly and weird kind of things going on. obviously, as you can see in, Michael J. Fox, he's got Parkinson's disease. All right, and so that's a neurological problem where the muscles don't turn on and shut off like they're supposed to. Wait, lots of laugh. If I got the rod put in, you think it would help me walk? My neural sucks. My neurologist sucks. Well, you have to look at the cost-benefit ratio. If you're talking about putting a rod in your spine, the first thing that they'd look at is seeing if they could correct your scoliosis. A lot of times they're only going to correct your scoliosis is if you're having breathing problems. If like you're saying your ribs stick out one side because you're rotated, and so if it was affecting your breathing, then they might correct your scoliosis. Now the problem is that you can correct your scoliosis and affect your, and hopefully get your ribs to open and close like they're supposed to, kind of like a bucket handle. We used to call it the buckle handle, and how we breathe in and breathe out. That's a whole other discussion about inspiration, expiration, and what muscles do what, as well as our diaphragm. But if we just took the basics of doing a rod or fusion, they would probably only do that as if it was affecting your breathing, affecting of how your ribs open and closed, not putting a rod in you to see if it's stable enough to make you walk. So there's a lot of things that go into play. And that's saying that would that affect your pain-wise? That might make a lot more pain in the spine area if they correct that. So it's a huge cost-benefit ratio when it comes to pain and motion and breathing. The benefit is if you're having problems breathing, it would get you breathing correctly again. The benefit, breathing better. The cost might be a lot more pain. It's hard to tell. If you haven't connected with one another, go ahead and connect. I'm going to eat my cauliflower. I'm eating late again. Never good. That's all right. I don't have to go into work till later tomorrow anyways. Woo! They flexed our time, so we're not working full days. Which ain't good because you don't get paid as much. But I still got a job. Always a big plus. So looks good. Brown-eyed trucker, BET, coming in hot. I saw your last video there, BET. I liked it. I loved all the mud. Oh, man. Did you get a lot of rain, or are you getting a lot of... Because you're up there with this Michigan area, aren't you? You're up there with the cold country. I'm down in North Carolina. I have my pool open. I haven't gone swimming, but I got my pool open. It's still too cold to go swimming. Anyways, I digress. Let's talk about the neck a little bit more and the muscles. So, we talked about whiplash, those suboccipitals muscles, as well as those small muscles along the spine. They get snapped forwards when you get whiplash, and they can have what we call micro tears, and that's not good. Eddie Mark's in the house. Hey, brother. How you doing? Oh, yeah. Go ahead and subscribe to me. I'd love to have you. Hit the bell. You see my content. I do lives on Wednesdays and Sundays. Sundays live is more of like connecting and looking at discussing videos and stuff like that. And then my Wednesdays, tonight's is talking more like, more of the physical therapy, answering questions, kind of going over parts of the spine. Now tonight we're talking about the neck and the mid-back. And then Saturdays are my shows with Scully and my two bozos, Dr. Know-It-All and Dr. Cool Cats. But go ahead and get connected. I'll go ahead and, if I'm not subscribed, I'll subscribe to you afterwards. Let's go ahead, and so we got those neck muscles, those larger ones that we talked about, this, what we call the SCM, or Stone Cloud Mastoid. Those are nice short little words, SCM for short, the acronym. The scalenes, all right, the suboccipitals, the small muscles along the neck. A lot of those muscles that get inflamed. The big one, the levator scapula, that runs from the top of your, and I did a video on that way back when, the thumbnails with the muscles in green, but it attaches here at the top of your shoulder blade and runs along those transverse processes of the side bones. And so if you're having a lot of mid shoulder blade pain up into the neck, it's probably coming from that levator scapula muscle. And I got a whole treatment, you can look on my playlist about that, with TENS units and Theracanes and massage techniques and taping techniques. I talk about what you're not supposed to do, which is stretch, because the more likely that is it's an overstretched muscle to begin with that's got it all inflamed, and the last thing you want to do is stretch the darn thing out more. It's already overstretched. So that's huge. I've had tendon transfers, or okay, sweetheart, enjoy your dinner. Yeah, tendon transfers are something else, man. So this nice lady's had a lot of work done, trying to keep you mobile, keep you going. It's not perfect. It's definitely not Star Trek, though I'm a big Star Trek fan. Oh well, no one's perfect. Also, realizing if you're having neck pain, if it's not from a trauma like a car accident or something like that, you slept wrong, you fell asleep on the side of the couch, you woke up, you got this huge kink in your neck. A lot of times it is just that upper trapezius muscle, and maybe your scalene's a little bit on the side that got all tight and irritated, and now they don't want to release. You might have even inflamed the facet joint off to the side. We're kind of looking at it this way, that joint off to the side, because if you're kind of slight and rotated, that can give you a lot of symptoms. So be mindful of that. Sleeping wrong, you might want to just do some heat and kind of rub it. Get one of those Theracanes that I talk about all the time. Those are perfect for that, as well as, knots in your neck and your shoulder blade area. You can hook right into them and get them to loosen up for you. Brown Eye Trucker says, you made me hungry. I'm going to go start dinner. See you next time. Later to all in the chat. Bye, BET. Thanks for coming. Yeah, she always gets hungry this time, too. I don't blame her. This is really good, though. It's probably not the healthiest thing, but it's grilled chicken with bacon wrapped. That's right. Grilled chicken with bacon wrapped around it. Very good. The chicken's healthy, but not the bacon so much. I don't know if X-Ray Lady's still here or not, Eddie. She might not be. She might have left. She's just an observer. She's not a content creator. She might subscribe to you, but she does not have content. All right, so when we come to this mid-back, and we got those ribs coming around, that's really stabilizing these spinal disc a lot. So a lot of times, even if you're having, you might have a degenerative disc or whatever in your mid-back, that's probably not where your pain's coming from, because the ribs stabilize that mid-spine so much. It's too bad that we don't have them stabilized up at our neck and have a few ribs or something down here at L5S1 to stabilize this little part of our back. We'd probably be a lot better off, though we would lose some mobility. And that's kind of like what they do for a surgeon. If they do a fusion or they do rods and plating, really what they're doing is trying to stabilize or fixate that part of the spine so it doesn't move no more, and hopefully that reduces a lot of the stress on the joint. If you take that in conjunction with changing your whole lifestyle, because a lot of these people that have the surgeries, they continue to keep doing what they were doing that caused the problem in the first place, whether it was sleeping incorrectly or sitting incorrectly or doing the type of work that they were doing incorrectly. A lot of people, it's very hard to change, but the reality is when you go to the extremes of having surgery, you really need to take a closer look at probably what was causing the issue to begin with. Ms. Cortez says, interesting, yes, I was told about the pain and all that could be worse. Thank you. Yes, I was talking about spinal fusion and changing the scoliosis that she might have, the twisting motion in her back. If they fix that scoliosis by putting rods and plates in her back and straighten her out and fix her ribs up, a lot of times you can have a lot more pain because those joints, you're changing how they've moved. And not only have you changed how they moved, you're then making them stay at one spot permanently without allowing them to move, because our joints naturally are nourished by synovial fluid, and that synovial fluid loves movement because it allows that fluid to come in and out of the joint when we move. And when we move and twist and turn, our joints move up and down, and that squeezes the synovial fluid out and brings the synovial fluid back in when we relax. But when we're stuck in one spot too long, it kind of squishes it down and no fluid can go in or out. Eight in the house. Eight in the house. Eight in the house. Give me a shout out if you haven't shouted me out. I'd love to have it. Any questions? Got 9. Oh, someone threw back in, had 9. Beautiful. Any questions at all right now? I'm going to go get a quick snack for a second. Just throw the question down below. I'll be right back. All right, folks, I am back. 7 in the house. A couple of people dropped out, so I gotta go. Let's see what I got. Sometimes I have to refresh this because it didn't show correctly how many people are actually here. All right. Miss Janet Cortega, hi. I sure don't know how I ended up here, but are we talking about inflation in our bodies? Inflation? Oh, inflammation. Well, you can if you want. Inflammation is deadly. I got it in my lower back right now because I did too much yard work over the weekend. So right now on me, I'll take that little piece of candy right there. See that little spot? That's your facet joint where that candy is. My ear is all inflamed down there because I did too much repetitive bending, twisting, and stooping motions. Even with me fairly strong, I still got the thing irritated. So you can expect a good 72 hours or a nice 3 days of inflammation before the thing starts to calm back down again. Oh, turmeric. Yeah, sure. It's healthy anyways. You know, there's a whole, I mean, I'm not a registered dietitian, I'm a physical therapist, but you could easily go on to Google and type in, you know, inflammatory versus non-inflammatory foods. And yeah, turmeric's one of them, non-inflammatory. If you'd like to connect, Janet's here. If she wants to connect with you, that would be awesome. Janet, I was talking about the neck and the mid-back area and how the structures of the neck as well as the structures of the mid-thoracic area or the cervical and the thoracic area. And obviously it's represented by purple, and the blue is the mid-back area. It gave me diarrhea. Well, yeah. Something in your digestive system didn't like it. Probably killing some of the healthy bacteria. Any questions at all? If we want to talk about good sleeping positions for your neck, because there's only a million different pillows out there in the world, the My Pillows and everything else that you see on the market that cost a fortune. Should you start up again? No, if it gave you those symptoms, I would start up again. I would stop eating. I would try and instead of adding food anti-inflammatories, I would try to reduce foods that cause inflammation in the first place. Like this candy I'm eating has probably 1 billion chemicals in it that probably give you inflammation. But this water doesn't. Classically, people are mainly dehydrated. If you looked at people who have chronic inflammation and stuff like that, a lot of them don't drink enough water. You can start out by that by drinking more water. Less sodas, less teas and caffeines that are diuretics that dehydrate you. So that's what I would do. I'd start removing this. I would go on a website and see what foods you're naturally eating and see if they cause inflammation. And I'd start to take them out one by one and see how you do. Literally the process of elimination. That's why it's called, you know, practice medicine. A lot of times with all kinds of medicines, the physician they have a baseline understanding of, you know, weight and height and age and what this medication could possibly do to you, you know, and the normal dosage amount for someone with those particular classifications. But, you know, you always have to talk to your doctor too about that stuff too. Should I start up again? How about Crystal Light? Do I Google that? I mean, yeah. I mean, Crystal Light probably. I mean, you're talking about aspartame, right? Crystal Light has aspartame in it, so you'd have to type that in and see. You know, look in the back of the container of Crystal Light and see if any of those chemicals back there are cause inflammation. You'd probably be surprised. A lot of them probably do. I mean, it's a lot of work. Definitely not easy to find out, but anything that's probably processed is probably got inflammatories in it. Fast foods probably have a lot of inflammatories in them. You're talking about, your fresh whatever, your fresh vegetables, your meats that are organically grown. Stay away from antibiotics and steroids and stuff like that. Yeah, it's more expensive, but they have a lot less inflammatory properties within them. I think we're down to 5. We're whittling down. People are fading out. Whoa, 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 whoa. I've been on what? Almost 2 hours? I can't tell. What's it say back here? Does it say 2 hours? Live, 1 hour and 47 minutes. Not quite 2 hours yet. They took me off soda 10 years ago, so went to Crystal Light. Yeah, I mean, you went off of sodas because they had a lot of sugar in them. 130, 150 calories. Some of them, I don't know if they're 180 calories depending on what it is, but most of them are like 150 calorie for a 12-ounce can of soda. So, you're just sugaring it up big time there. I mean, if you're drinking, that's why if you can take your calories in more by food than you do by your liquid, you'll be better off. I mean, I just had probably 100 calories of just candy there for a second, and I don't have a soda, then to add more injury to insult. You drink some more water than the soda, you're better off. People are like, I don't like the taste of water. It's kind of like you kind of have to get used to it. It ain't, it's one of those things. But yeah, I mean, it's a give or take. I mean, Crystal Light's better than soda. Obviously, it is, but it's you have to also look at your foods, what foods you're eating that possibly could give you more, that have more inflammatory properties. Oh yes, Miss Janet's diabetic, so you're probably a type 2. I'm looking at your picture. So your age, you're not a little kid, so you're not a type 1, possibly. So you're probably just a type 2 diabetic. So yes, you want to stay away from all that stuff, and you got to stay away from certain types of vegetables too. Because of diabetes. So, where am I? I love this channel. Where you're at Average Joe PT, girl. Average Joe PT. You need to subscribe and hit the bell. Scully and I bring content once or twice a week. We do lives on Wednesdays and Sundays, and we do our shows. You should hopefully expect it sometime on Saturday. Our show, where we do it this week, will be on disc. We're going to be talking about the disc this Saturday. Will be Scully in my show. You can look at my last week's show, which we talked about, and we went outside. And you can look at that one. I do a lot more animation. I do After Effects graphics and stuff like that. And so you can also obviously tune into that. I have a nice playlist that goes over different types of joints and back problems and hips and knees and shoulders and stuff like that. And I'm always continuing to update or up myself when it comes to the content and how I actually give you the content. Hi, it's Medic Bunny. Hi, Medic Bunny. How you doing? Medic Bunny's in the house. Say hi, Joe and Scully. If you don't know Medic Bunny, she comes in. She's awesome. You can connect with her if you'd like, if she would like to connect with you. Tonight, Medic Bunny, we've been talking about the neck and the mid-thoracic area and all the stuff that's involved with that, going over the actual joints, the anatomical structures a little bit, going over the nerves and where, if you have a nerve issue in your neck, where it might present in the arms or the hands. We talked about the mid-back and how the ribs really support the back a lot. And we talked about the different, where they connect to and some different symptoms you can have with ribs. We talked about a little bit about scoliosis. We had a sweet lady in earlier, Miss Cortez. And She's got muscular dystrophy. She's got MD. She talked about her issues, and we kind of went over some stuff with that. See if we could help her symptoms a little bit. I also told her definitely go back to her neurologist and see if they could help her a little bit. Saturday's show is going to be about disc, so I'm slowly kind of getting that kind of put together as we speak. Scully and I are. And I talked about some injuries you can have in the neck, like whiplash, suboccipital muscles, and suboccipital headaches. With those muscles that run here, Scully, let me just take you for a second here. And some of those muscles that run the base of the skull and the second vertebrae, second spinous processes, okay, C2, and those muscles attached there to give you that nodding, your nodding reflex, yes as a nose, and so you can get a lot of referral pain coming from that, what we call suboccipital headaches, and kind of like the feeling like you're off, feel kind of out of yourself, not dizzy or lightheaded, but kind of somewhere in between when those suboccipital muscles get inflamed and irritated. Be right back. I'm going to go see if I can find you. Well, you're already on my channel, sweetie. All you have to do is all you got to do is subscribe. Hit the subscribe button. Literally the word is to subscribe and hit the bell next to it. Okay, maybe she'll be back. I hope so. She seemed quite nice. So, and we talked about there's 8 nerves of the neck, and there's only 7 vertebrae. And number 7 is that big one that we can touch in our neck, C7. And then from there it goes T1. And we didn't talk about this yet. This is new. You go all the way down. T1 starts at the top. T2, 3, T4. T means thoracic, or we say mid-back average Joe style, don't we, Scully? He ain't talking right now. It comes all the way down to T12. So you have 12 thoracic vertebrae. Each one of these things is called a vertebrae. Oh, actually, technically, this is called the vertebrae body, if you wanted to be technical, or vertebral body. And then you come down into the green here. This one here, so T12 goes to L1, or lumbar spine, or L, or low back. Technically, it's called lumbar. L1, 2, 3, 4, 5. And then you have your S1, sacrum 1, or S1. And so that's where you have the fused bones of your sacrum, usually. We did talk about, 3 live streams? One of those, where we talked about where S1 and S2 is, where some people, they have a kind of a congenital disc in there, a small little disc, where it never fused correctly. So that's an abnormality that people can have, as well as you can have abnormalities in your neck or anywhere else in your body. Okay. Oh my God, that was easy. That's right. I hope to make it easy for you. That's right. Thank you so much. Welcome aboard, Scully and I say, yee-hoo, we got ourselves a good one. All right, I got too many headaches. I watched the video where you talked about the muscles in the side of the neck. So you're talking about the medic bunny. I'm just going to start calling you bunny. Maybe I should start calling you medic, since you're, that could be sexist or something. Anyways, I'll call you bunny. No, I'll call you medic. Medic sounds better. Anyways, so you're talking about the one where I talk about the suboccipital muscles, the ones that run the base of the skull. I know I did a video on that, which we talked about, like chin tucks. We talked about icing it. We talked about postural alignment. We talked about doing a towel roll to unload those muscles in the base of the neck. My niece calls me Bunny. Way to go, Janet. That's right. Positive reinforcement. Positive reinforcement. So yes, I did one video on that, as well as I did another one called the levator scapula muscle that I showed earlier on the live stream. That muscle runs from the shoulder blade, the top right where I'm pointing at, okay? Or this is actually called the superior angle of the scapula, and it runs all the way up to the transverse processes, or the side bones of the vertebrae, 4 of them on your cervical spine, and that can give you a lot of pain generating from your neck all the way down into your shoulder blade. Your scalenes can get irritated. I don't see that a lot. They can get tight and restrict your motion sometimes, especially your lateral, what we call lateral flexion or lateral bend. You know, if you go to the left, ear to shoulder, you know, it's the right side that's kind of holding you, and they could be tight. Your sternocleidomastoid can give you pain along the back of the ear, give you an earache if that thing is inflamed, and so that can cause you restriction. You could, you know, your whole first rib, you have one of your scalene muscles that attaches to the first rib underneath your collarbone and runs up, and so that could give you pain along the side here. So there's a few things, but most times than not, it's the base of the skull muscles and around the back side of the head that gives people more of their neck pain. Africa, France Lady TV, thanks for coming. Hello, guys. Yes, the scapular one. Yes, the levator scapula, the one I showed where I showed the muscle in green so you could visualize it a little bit better. Yeah, that's a huge one. That messes a lot of people's shoulder too. If they're having issues raising their arm up and down, that thing gets really nasty because that's one of the main rotator muscles of your scapula, of your shoulder blade. And so if you don't have your shoulder blade sitting right on your body and you're very what we call rounded or protracted, your shoulder blades are rounded forwards, that'll cause a lot of irritation through this whole muscle group because the muscles do cross multiple joints, like the shoulder blade muscle, as well as this big upper trap muscle runs along the base of the skull like an L, literally like the letter L. And so if we showed you on this side, you know, that upper trap, pretending it's my finger, runs all the way like this. And so it runs the entire part of your cervical spine and then comes across into your shoulder. It's your main shrugger. I don't know. That's your main shrugging muscle. And so people that have a lot of shoulder dysfunction, I call it, have a lot of levator scapula issues, as well as their upper trap works too much and their rotator cuff and stuff does a bunch of wonky things. So that's a whole other discussion. If you guys would like to connect, that would be awesome. If you haven't met each other. If you don't, hit the thumbs up. I'd love to have you hit the thumbs up. If you didn't like the live stream, you can always hit the thumbs down. I'm hoping you wouldn't, but at least I know you spent the time. You can hopefully subscribe and hit the bell so you get my content. Like I said, I do it on Wednesdays and Sundays as live streams when I can, as long as we're all feeling good with this crazy virus going around. As well as I try and do my shows at least set. Sometimes I can, if I get enough during the Friday, I can get it in early on Saturday. And sometimes if I do a lot of editing or I'm trying to add some new stuff to the video, sometimes it's late Saturday or early or Saturday afternoon. But I try and get it in the morning. Excuse me. Do you guys have any questions at all about the neck or the mid-back? I'll be right back if you have a question. I'll be right back. All right, I'm back. Let's grow. Show some fun. Africa Francis. Lady TV. Medic Bunny, let's grow. Show some love. Yeah, you can go ahead and hit her little YouTube hyperlink. That'll take you right to her channel, so that's a good idea. Okay. So we talked about that levator scapula is a real stinker. We talked about sometimes even the upper trap. I mean, you can get that darn upper trapezius muscle can get knots in it, and people start kind of rubbing here. If they, if you are very soft and superficial or at the surface, you're hitting the upper trap muscle. People end up going much deeper, and you're actually hitting the main rotator cuff muscle, which is right where I'm showing right here. And I'm trying to think. Oh, I can use this. So let's just pretend this pink paper is one of the main rotator cuff muscles, and this is actually called your supraspinatus, but it kind of sits inside. The muscle belly sits on this bone inside this little groove here. The muscle belly does, and it runs all the way over and attaches to the tip here. But people, they work so deep, they're thinking they're working the muscles on top, but they're not. They're pushing so hard, they're actually getting into this rotator cuff, the supraspinatus. And yes, you can have a lot of what we call trigger points or active knots in this particular muscle group. And look what's right next to it. Right next to it is that levator scapula. And so a lot of times, so we'll kind of point it, so that levator scapula kind of runs like up in there on that side. And so a lot of people will start to, work that whole shoulder blade area and realize what you're hitting at is probably hitting that levator scapula and also the rotator cuff. You're really not working on your upper trap or your shrug muscle. Medic Bunny says, what is the name of the massage stick thing you have? I want to order one. Lots of laughs. Seems like it would work better than a tennis ball. That's right, it does work better than a tennis ball. I have a hyperlink on a couple of them. It's called the Theracane. 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 A lot of my newer videos I have in the comment section, I have the links to like the TENS unit or the taping that I use, the Leuco tape or the Kinesial tape. In the comment section, I put a hyperlink so that you can go to the site. Now, I don't get no money for it, but it's the cheapest that I can find it. Like the TENS unit I have, I found it, but the site I have it at, it's the cheapest I can find it, as well as the Theracane. I think the cheapest I found that thing was like $9 or something like that. The most I found that thing has been like $25. So you have to shop around a little bit there, Medic Bunny, because I've seen it as low as $9 and $10, but it's called a Theracane, and I have one. I love it. I use it. You could actually use a regular cane, because really all you're doing is using the yoke part to push down in that angle. Yeah, they're nice. I'm also trying to incorporate, when I can, like that particular cane for some of the other treatments, because I want to get where it's taping techniques, positioning, the Theracane or massage techniques, and stretching and strengthening, obviously, as well as a TENS unit or heating and ice or whatever to kind of manage your pain at home. So that's what I'm trying to get to, like the home therapy techniques. I got 9 in the house. I use a ton of ice when I have a migraine. Heat seems to make me nauseous. Yes, it will. If you want to slow down nerve conduction, okay, or the speed of a nerve, you want to ice it. Heat is going to speed things up and make, if it's inflamed or hyperactive, like what migraines are, as well as the muscle groups around the area are hyperactive, when you heat things up, you're just going to speed it up even further. So you're increasing your symptoms. Icing slows things down, contracts things. All right, so if they're in spasm, it's going to slow that spasm or pain down. It slows that nerve pain signal down, so you're really not having the symptoms anymore. Yeah, it's pretty crazy, isn't that, Scully? We do make sense sometimes. He's not talking right now. He mumbles the words. Okay, so the tough part is you can use a Theracane, some positioning. Oh, that reminds me, the pillow thing. I got sidetracked and didn't get to the pillow. So, there's you can spend tons of money on pillows, and people have, trying to get some more sleep or better sleep. What you want to do, he needs a mask. Yeah, he's pretty shy. I tell you, when I get him talking one of these days, boy, he's not going to shut up. But with the pillow, you want to make sure that you're supporting from basically the shoulder blade level, okay, all the way through the occiput or the base of the skull. If you're not having a pillow that's supporting the entire area, and you only have a pillow that's supporting just here, or it's a pillow that's supporting just here, it really starts to cause pivot points above or below or above the pillow. So you always want to have a pillow that's going to support the entire base of the skull all the way down to where the shoulder blade is, or the mid-back area. That way, you unload or take the stress off the neck and you put it through the whole area. The more weight you can displace through more part of the spine, the better off you'll be. That's the reason why the spine is designed the way it is. It's designed as S, so it gives you a recoil effect. It takes the shock off of one vertebrae or off of a couple vertebrae and displaces the pressure through the entire spine. The same way when you're sleeping, you want to make sure that you have the mid-back as well as the occiput all supported, so that the weight is of your head and your neck are all on the same plane, as well as it's all being supported at the exact same basically the exact same level is what I'm trying to get to here. As well as the more area that's supported in one plane of motion, in this case, the better off your neck will be. Whoops. Okay. So, you'll see a lot of the pillows, the newer ones, you'll have like this curve that goes in, or what we call a concave, okay, caves in, and then it kind of bevels out, kind of flattens out and thins out. And so they are trying to take the weight off of the neck and put it down more towards the mid-back. And that's what you want to try and do, because you have your ribs. Plus the vertebrae are much bigger. The discs are much bigger. They can take a lot more of that pressure over a long period of time, and that should reduce a lot of your neck pain. Now that's lying on your back. If you're lying on your side, you're always dealing with the whole issue of filling in the gap between your ear and the actual shoulder itself. So, I mean, you could always take a couple nice towels, roll them up, put some tape around it, and put your head there. I think that would work just as well as anything else. It's dense enough, so that's firm enough that but it's also soft enough so it doesn't feel like you're sleeping on a rock. So I probably would, if it was me, I would take a beach towel that's fairly thick and wide that can fill up the whole gap for you. And that way, you can move it from side to side depending on if you want to roll from one side to the other when you're sleeping at night. Janet says, I have to leave now. Do you have a IG when are you on again, please? Oh, do I have Instagram? Yes, I do have Instagram. On my main web page, Average Joe PT, you'll see an icon that you can click on. That's a hyperlink for Instagram, as well as I have a link for Twitter. So the little icon there on the right-hand side of my channel art on my main page, you can click on those, and that will take you right to it. But I am Wednesdays, sometime between 5 and 5:30 until we decide to end. Saturdays are my show, and then Sundays is my next live stream. I try and do between 10 and 10:30 in the morning and go till when people want to quit. And that's also on my channel art too, on my main page, with the physio ball and the floor. You can see, the times and stuff like that on my YouTube channel. Thank you so much for coming, Janet, and hopefully I will see you again. I will be coming to you and everybody else that I didn't get to and subscribe to you. I just can't do it now just because I'm currently in a live chat. All right, does anybody have any more questions in regards to the neck or the mid-back? Saturdays is like 10:30 in the morning Eastern Standard Time. I've been doing it, so that's the last probably 3 or 4 live streams on Sunday. Oh, what time on Saturday is my show? If you just click the bell, it'll go ahead and it will notify you when I make my Saturday show. I try and get my Saturday. Now that's not a live stream. That's actually a TV. That's actually my show. I try and do that late morning, early afternoon on Saturday. That comes up. By the time I can get that downloaded onto YouTube. Oh, thank you, Medic Bunny. You're sweet. Well, thank you so much, Janet. I appreciate you saying that. Saturdays you can watch anytime, Janet. That's true. Yeah, you can watch anytime on Saturday, or anytime after. I mean, it's once it's uploaded, you can watch it at any point. It doesn't have to be Saturday. I usually get it downloaded onto the YouTube system on Saturday. I'm trying to start to tweet and use Instagram more to update people when I'm doing my next live stream like I did tonight. I shouted it out to them as well as LinkedIn. I use LinkedIn a little bit. All right, folks, if you don't have any more questions, I'm going to go ahead and call it a night. We did a nice little 2-hour session on the neck and the mid-thoracic area. I want to thank everybody for coming. Go ahead and leave a thumbs up, subscribe below, hit the bell if you haven't, which I'm sure most people have. And we will go ahead. Be safe, Jaron Scully. Yes, we will. And I'll go ahead and we'll see how we do on that Saturday show. Like I said, we're going to do it on, the topic is going to be disc issues and disc pain. So we'll see what we can do with that, with us and Scully. All right, see y'all next time. Bye for now.